I am Dr. Mary Schroth, Chief Medical Officer at CARE SMA. With me is Dr. Nancy Kuntz, Pediatric Neurologist and Medical Director of the Mazza Foundation Neuromuscular Program at the Ann and Robert H. Lurie Children's Hospital of Chicago. She is also Professor of Pediatrics and Neurology at Northwestern University Feinberg School of Medicine. After a positive SMA newborn screen result, what does SMA care and treatment look like at the SMA Specialty Clinic?
There's a little bit of variability between states and between centers because in some states, the confirmatory gene testing is part of the initial newborn screen. However, in most of the states, the positive newborn screen stops right there. And when the job, as it were, the responsibility is passed over to the primary care and SMA specialty center, confirmatory gene testing still needs to be done. But as part of that, doing that, one of the big responsibilities is to actually meet physically and quickly with the baby and the family, both so that all of the education about exactly what spinal muscular atrophy is, and then what the treatment options are, and how they might benefit the child, and also what the monitoring requirements are going to be, how it's going to impact the family, and what potential side effects are. All those things take a long time to discuss, but it's important that that be done in person so that not only can you get to know each other and bond a bit for this project that you're going to be working on so carefully for the next few months, but also so that the specialist can examine the baby. At that first meeting, it's not only necessary to obtain the blood for the confirmatory gene test, but also to examine the baby to see if you see any subtle, small signs of involvement. And many times it's very important to get a physical therapist who's actually been trained in being very, very valid and very, very picky about grading different movements and reactions that babies can make, because that clinical evaluator assessment is many times required for pre-authorization of many of the treatments that can be offered.
The other advantage of the in-person evaluation, in addition to being able to evaluate the baby and have conversations with the family, is that they can ask questions.
Oh,
They often don't even know what to ask until
yeah.
they come into the clinic and the conversation starts. So that collaboration starts early and it should happen throughout the care of the child.